Well, hey everyone, and welcome to another episode of Doctors Living Deliberately. Thank you so much for joining us today. And of course, welcome to my co-host, Dr. Arpita Gupta DePalma. How's it going?
It's going great. How are you doing, Michael Hirsch?
Great. So much enthusiasm from you this morning.
It has to do with her guests.
Great.
Yes. Well, speaking of our guests, we have a very special guest today, Arpita, and I think you should do the honors of introducing him to our audience.
All right. Well, we have with us today my amazing husband, but that's not really, I mean, I guess that's probably the best part of him. No, I'm just teasing. But this is Dr. Michael DePalma. He is a board certified interventional spine physician with the residency training in physical medicine and rehabilitation. He went on to do his fellowship in interventional spine care at the University of Pennsylvania. And I guess the way I would describe this man is a brainiac visionary. He loves to do research. He's got multiple research trials in his medical practice. He went on to, after being the director of the spine center at various different facilities, after he graduated, he actually decided to go out and build his own practice, which is Virginia iSpine Physicians. And that is where he is the medical director and president. He has a fellowship training program where he trains fellows every year there. The research arm, when I say he's a visionary, I mean that he's always thinking of new ways and to expand his field, new ways to apply the research. And if that wasn't enough, he's now launching this new enterprise in a sense where he is incorporating integrative medicine into his field of practice. And so I'm going to hand it over to him in a sense to say, where did I miss anything? Fill in any gaps?
I don't know. I feel like we have to do a fact checker to make sure all that's accurate because it sounds impressive.
Aw.
Yeah, at some point, I'm going to have Arpito write my bio so that hopefully it can sound that impressive when people are talking about the things I've accomplished. Well, that's amazing. And I know that you are in the process of completing your integrative medicine fellowship. I was wondering, we've talked a little bit about that on this show before. Can you tell us a little bit about integrative medicine and how you got involved with it?
Yeah, it's a good question. I was thinking about that a little bit a second ago. And in my journey, just to back up a step, and we've talked about this before, I recognized that I was in burnout and got connected with professional coaching, you, and then another coach. And over about a year's time, I pulled myself through that with some help. But along those lines, I saw what Arpita was going through and how she was evolving. And she actually put me in touch with a few of her colleagues who had completed Andrew Weil Integrative Medicine Fellowship Program. So I was intrigued.
One was actually Dr. Dinsmore, who was on one of our earlier episodes talking about perfectionism. She also completed this fellowship. And I don't mean to cut you off, but you did already, he just actually graduated. So he is completed now, the fellowship. But yeah, go ahead.
I'm due to graduate upcoming. Yes, I travel next week to complete that graduation. But yes, I'm at the end of that road. It was a 2-year fellowship program. I learned a lot. But one of the things I learned from Dr. Weil was that the body wants to heal. And our role as physicians is to identify the barriers, to help identify the barriers to the healing and then guide the patient through steps to achieve healing. And I've learned a lot about other areas within integrated medicine, one of which mind-body connection, which we hear about that stuff through our traditional medical training, but don't get in-depth education and training in those things and those techniques. So that was one big takeaway over this past 2 years.
You were mentioning kind of your path to burnout and kind of getting connected to integrative medicine as kind of as a modality, but what inspired you? Like, how did you kind of start to integrate it into your life, integrate integrative medicine? And then what made you decide to go ahead and get additional training in it?
I would say, yeah, I think we all are information seekers. If there's something that's puzzling, we ponder it and then we seek information to explain it and ultimately heal or get through it.
Well, I'm going to cut you off because I think if you go back to even before you started coaching, all of this started to transpire when you found out about your dad's diagnosis. That's what I think put you on this path of learning about this a little bit. I mean, I might be wrong, but it might be interesting for them to understand your story, talking about that, like where it came from.
Yeah, I mean, so my father passed away from Lewy body disease early 19. And so over the several years leading up to that point, just trying to reconcile what the heck is going on and why, and then what are the implications for us, family. And inevitably, you'll learn about cellular homeostasis. I promise I'm not going to dork out and get technical, but just why things go wrong, why there's organ damage, and how can we intervene to head that off. If you look at areas around the world where folks live long, healthy, active lifestyles, it exists. It's not an oasis. And so what are those folks doing? How are they living? What can we learn from those other areas in the world to benefit ourselves? Because in America, we're not good at that right now. We intervene when things go wrong. So anyway, yes, that experience going through that with my dad kind of gave me a different focus on how to intervene to promote my personal health, and then how do I apply that to my friends and family. And then from there, everything else kind of fell into place. Went to coaching, got involved with the Integrative Medicine Fellowship, and I've learned a lot over the past 2 years.
Yeah, it's amazing how life can kind of take us on this journey, and you kind of start to kind of pull at a little thread, a loose thread over there, trying to sort something out for yourself, and it just kind of takes you down this path that kind of leads to all of the kind of the transformation that you've seen in your life over the last couple of years. So it really is incredible how that all happens. And so talk to us a little bit about what was involved in your integrative medicine fellowship and kind of what you've done over the last couple of years.
Well, the fellowship, there's a curriculum. It's well set out. It's largely online, but within that, there's modules we read through. There's assigned reading in a large textbook. There's videos. With about half of the course, we had small group meetings via Zoom every other week. And then we had three weekly on-site meetings in Arizona, where we came together as a large group and had lectures, didactic, group sessions, and it's really fun. And so as you touched upon threads, and that's exactly right. It's how I would describe it as well, because the reading, there would be things that would be introduced in the curriculum and that I found interesting, that I would explore that further outside or in addition to my curriculum. For example, heart rate variability biofeedback, transcutaneous vagus nerve stimulation, pulse electromagnetic field therapy, photobiomodulation, just fascinating things for how to intervene to promote cellular health. But also back to the mind-body connection, learning about some of the basic science behind demonstrating the positive impact of those exercises. For example, meditation, it's been shown that inflammatory markers in the bloodstream are reduced as an impact of meditation, which, I mean, I find that interesting, fascinating, because we hear about meditation, kind of know a little bit about it, how you're supposed to do it, but you don't, as a physician, I didn't realize and understand what it was doing at a cellular or system level. And I can start to get my arms around that and embrace a little bit more strongly when I understand better and believe more in it. And I think that's also the power of the mind and our thoughts to affect change at the cellular level exist. And once we start to harness that more effectively, we can use it to our advantage. And I think that also is what folks are doing, these blue zones, when they are what we might say coherent, or they have a balanced sympathovagal tone. So they're not stressed out all the time like we might be here in America, when we are constantly deluged with information from social media that may or may not be factual, but we believe it.
Yeah, I think the best way to say it is that my nerdy husband that I love has figured out that there's actually evidence-based scientific data backing what all of these wellness modalities have offered to us. And so for the non-believer in meditation or, any of these other therapies, this actually gives backing, like data to back it up, that yes, there is evidence to show that it does work and how it works. And so I think that was kind of interesting to see as he went through the fellowship, where he was so immersed in wanting to learn, which he always is, but wanting to learn in a different realm and then apply it even to his field. So, I mean, obviously, like I said, he's an interventional spine physician for 20 plus years. He's been procedurally based, working with patients who have back pain and other types of pain, and really, I think, was starting to burn out a little bit. Now I'm speaking for you, with regards to doing the same thing over and over and over, and it being more of a Band-Aid rather than preventative. And so do you want to speak a little bit about that, about like how this is actually going, how you felt like this would help you with your current patients and like what your ideas are with that, because it's unusual for somebody who's so subspecialized, you would think, to do an integrative medicine fellowship, right? This is something that you might also naturally fell more on like a general practitioner in a sense. So tell us about that.
Well, yes, I think the perspective for me, so for 21 years, have been helping folks get past, and move through conditions that represented, we'll say, in-organ damage. Disc degenerates, it's injured, it can't heal. And so we don't really have pro-healing or regenerative technologies available yet to help repair these tissues and organs, such as a degenerative disc. And there's a lot of research going on in that area specifically, and we're involved in that research. But by and large, we're reacting to conditions after they are present. So what can we do to intervene earlier on, or in addition to what we are doing, to help slow down these progressive degenerative conditions or help prevent them? And so, for example, I've started to incorporate these things into my current practice. Turmeric, for example, is a wonderful botanical. It has potent anti-inflammatory properties. So I start talking about these things to patients, and they are very receptive and welcoming to these ideas. And what was interesting to learn in this fellowship is that, I can't remember the exact percentage, but maybe it's close to 2/3 of folks in this country seek and spend money annually on what are called CAM therapies, so complementary alternative medicine therapies. And so people are looking for non-traditional therapies, and so they need legitimate guides, physicians, professionals, to help them sort that out. So I've started, it's challenging, as you guys know, to roll this into a traditional medicine practice, but I'm working on a different avenue for getting folks that sort of information. But yeah, I started to think more full circle, and actually started to experience some of these things myself personally. I've looked for answers to the questions I have, because backing up again, I am healthy, but I mean, I was not overweight, would work out regularly, eat healthy, wasn't a smoker, but yet I developed these symptoms during burnout that didn't make sense to me. I'm like, what is going on? Brain fog, fatigue, just angry, anxious, musculoskeletal aches and pains, and just feeling like crud. But despite that, still being productive on a professional level routinely. And so that just wasn't part of my fabric to feel these symptoms and have them. So it didn't make sense to me. And so that I started learning more about the impact of thoughts, and being able to more effectively manage stress, starting with the mind, and understanding better how that affects changes at the cellular level. That was all fascinating. And so again, now the word I chose earlier was that harness those exercises, interventions for my benefit. So now the next step will be to put that together in a program to help my patients.
Yeah. And I think I'm just going to add, like, part of what we don't recognize, and we've touched on this on our other episodes, is that we kind of get in our rat race routine, right? Our day-to-day lives start happening, and we get out of residency, we get out of training, we start with our family if we haven't already, we find our houses, get our like job settled, attending level, and we just keep going. And what happens is, at least what we found, is that you kind of get sucked in. You don't even realize, and you're not living presently. You're living, but you're not living with intention. You're not living with actually experiencing the present moment and experiencing your day to day. You're just going from work to home, and that's just not true living. And so, but we don't realize that the discontent comes with that, and it takes sometimes a full halt, some sort of event, to make you realize that this isn't really how I wanted to live. Like, is this all it is? Is this all we're going to have? And the answer is yes, if you don't want to be intentional, if you don't say, hey, something needs to change. But it could be also very much so, no, this doesn't really make sense. I have everything that I want. I've got the house, the family, the kids, the job, the practice, whatever it is, but I'm not content. I'm not happy. And that makes you wonder why. Like, why am I not happy? And I think that's oftentimes the incentive and the kind of the igniter for let me consider what's going on right now so I can make a change. So I think that was, we were fortunate. I mean, again, all of this started for us with COVID. I mean, and we go back to that. It was a full stop halt for us, literally, because the practice shut down, everything. And so we had the moment there forced upon us to pause. But that was where we were able to reflect and say, we have everything and we're not happy. So what are we going to change? Because this is not how I want to continue for another 10, 15 years until I retire, And we, again, going back to your arrival fallacy, when I retire, it's going to be great. Well, you know what? If you feel like shit and your body is like totally crapped out and you've like burned yourself to the ground, you're not going to be able to enjoy the retirement. So,
Or you have a chronic condition that restricts your quality of life.
yeah.
I think the other thing I'm going to highlight is, our traditional medical training, right, focuses on, as you were mentioning, kind of the things that have been researched and studied and best practices. And even some of those, as we know, are kind of assumptions about what we think probably is the best, even though maybe there's not a ton of research underlying those guidelines. And I think a lot of those guidelines are, consistently updated as we do gain new and additional information. But the truth is, the things that you are talking about in terms of meditation and health through nutritious eating and exercise, you know, these are not new ideas. And these, traditional ways of maintaining health date back millennia, right? And so the fact that we are now just learning how to incorporate some of these practices into traditional allopathic medicine, it's about time, right? So there is very little doubt in my mind. As a gastroenterologist, I see the mind-body connection present in my clinic every single day. And I've heard it said before, and I love it. The GI tract is the window to the soul, right? So there's so many ways that the mind-body connection shows up in our clinics every single day. And we are ill prepared by traditional allopathic medicine to manage a lot of these issues. And so when we can lean into how does meditation improve symptoms? How does thought work improve symptoms? How does nutrition improve symptoms? I mean, it all seems like, of course, we should be leaning into these other areas. And I think the other thing that you touched on, which 100%, patients don't necessarily want to take a medicine and they are interested in what are some other ways of managing my symptoms and helping me to feel better. And I love how kind of you are beginning to incorporate and learning to incorporate all of these to just allopathic medicine in a way that suits your patients. Can you tell us a little bit about, you were kind of touching on your plans for kind of how you see incorporating integrative medicine into your traditional practice. Can you tell us about that?
Sure. Yeah. So back to your point a second ago, folks, either they're not interested in a pharmaceutical or they have concerns, or they've been on one or two or three of them without really a lot of success. And so they're curious about other therapies, other ways. So I started to incorporate these things into my current traditional medical practice, but then quickly realized and kind of had an idea that I would need to do this, but I need to go in a little bit different direction to have time and really have the capacity to spend meaningful time with patients to guide them through a program to improve their quality of life. And so I incorporated an integrated medicine practice. It's integrated medicine, lifestyle medicine, maybe eventually some functional medicine, and it's called Connected Coherence MD. And the website is close to being in launch phase.
It might be launched by the time this airs. We'll see. It might be almost.
You can drop the website link if you want. People
Yes.
can check back.
We might have to include that in show notes.
You know what your website is. Just say what your website is.
ConnectedCoherenceMD.com.
I mean, maybe I need to coach you on this a little bit.
No,
Like,
no. It's just I don't want to like pitch it and the folks go to look for it, like, what's this guy talking about? It's not there.
It'll be
Well, yes,
fine.
it's not there yet, but it will be. And that, that's pause for a second. That's a slight reflection of my perfectionism where I want it to be buttoned up tight before I launch it to the world. Well,
I'll tell you what Arpita and I just did. We motivated you to get it done.
Yes, now the world knows. They're waiting. What the hell is this guy waiting on? One of my integrative medicine fellowship co-fellows made the comment last year at this meeting when we got together that if by the time you launch it, you're not embarrassed by it, you waited too long. So inevitably it's going to launch and I'll make additional tweaks. But so I'm working on this program that I'll offer to patients through Connected Coherence MD. It's probably going to be a 6-month program, telehealth based, actually, so it can work one-on-one with folks like we're doing now in a video chat platform, HIPAA compliant. And I'm excited about it because it's going to be one-on-one. There's going to be no third-party payer dictating what we do or what's going to be covered and what's not, or why, because the current medical model, healthcare delivery medical model, is not conducive to really what we need as patients. And I'll act as their expert guide to guide them through the process to a better quality of life. And this will be the initial program. I have ideas for subsequent programs, one of which will incorporate probably gut health, things like the impact of gut dysbiosis. And I don't want to get too technical, but it's fascinating to understand how much of a driver gut health is on everything else. Cognitive function, musculoskeletal system, some of the aches and pains, the insulin resistance that we might develop can be a reflection of gut health. So anyway, I was long-winded. I mean, did I even answer your question, Mike?
You did. Well, I think he did, didn't he? Yes, he did. Okay. I have a question about this though. Like, yes, you're launching this program. It sounds amazing. The 6-month program, they get to work with you one-on-one. They get like undivided, your attention. That's it. Nobody else, which is very hard, honestly, to get nowadays, I think. But if you had to look at your program and all the little, I know you've got like gadgets, I call them gadgets and things that you like to tell us quickly, what do you think is the most impactful piece of your program? And I mean, in terms of develop for yourself, even like that you've utilized that you felt the most transition with.
That's tough. It's like, what's your favorite movie? Well, I have probably 5 favorite movies. So what I have enjoyed is over the past, it's probably been 3.5 years now, I've experienced the impact of these different therapies and devices and use biomarkers and metrics to measure them. And I've noticed interval improvement with each one over time. And so now my program is a compilation of all of them. So it's hard to tease out one specifically. Like I noticed impact improvement with heart rate variability biofeedback. And then I started vagus nerve stimulation, incremental improvement, and there's other things too. So it's kind of hard to pinpoint one individual thing. So I think really to answer the question would be the whole program itself and stepping someone through it. I think what will be most rewarding and satisfying, probably obviously, is acting as the guide and seeing a patient from beginning to end, hopefully hearing and seeing their expression of gratitude and appreciation, but just seeing them feel better. And so at that point, they're going to be what we would say more coherent, more grounded, more resilient, happier, much like we all want to be. We just want to have an enjoyable, satisfying quality of life and reconnect with what's meaningful to us. That's one of the key objectives, help my patients reconnect with what's meaningful to them. And that can vary. So for some, it's playing with the grandkids. For others, it's playing golf. For others, it's enjoying art or just being relatively pain-free.
Yeah.
Did I answer your question?
You did. You did. I think it makes sense. So
I think the key here is the connection, right? Like the clients that you're going to have, the people that you're going to be able to interact with, they're going to get a chance to interact with a physician who maybe they don't have that ability to connect with the person that is providing them care on that level, one-to-one, without like somebody staring at the clock the whole time, just trying to get to the next room. And also, reconnecting with themselves, right? Because I think sometimes when we are, as Arpita was alluding to earlier, kind of stuck in the rat race and just kind of moving through life, we lose that connection even to ourselves, and we never pause to take a moment and try to figure out like what's going on for me. And so for you to provide that opportunity for the people that you're working with to connect with you and reconnect with themselves, I think that's a phenomenal opportunity. And I think this sounds amazing.
And that I was deliberate with choosing the name of the practice, Connected Coherence. So if you look back at the blue zones, one of the 9 features of all the 5 blue zones is social connectedness. And social connectedness, which also includes the family, like the elders live with or close by to the younger generations. And then the coherence, we won't, there'll be a whole nother podcast episode about coherence. What is that? But coherence can promote cellular homeostasis in the regenerative efforts of the body rather than being in a sympathetic overdrive state where it's fight or flight all the time and we're constantly running and we're not resting, digesting, and healing.
I think one of the most important things here, just even to start, is just to give yourself the opportunity to have an open mind. A lot of people, like you mentioned, are already considering this and want this. They're like actively looking for it. And then there's honestly people like me on the other spectrum. When he started telling me about this 5 years ago, for even before any of the official training started, super skeptic. And I kept telling people, I know he's giving me supplements and helping me with things, but if I ever die, you need to check him out because he's giving me all these pills. And it's not all just about the pills. It's like all the other modalities, like he mentioned, like the vagus nerve stem and stuff. And I slowly started implementing them and started recognizing, yeah, it does actually make a difference. So I would just put out there to have an open mind and consider it if this is something that you feel you want to get back to living an intentional life and just being happy and feeling better.
I can't believe we got this far into the episode and have not yet talked about the skepticism. I think that's amazing. And I'm so glad you brought it up because I think that that is something that is a major aspect that holds physicians back from learning more about integrative medicine. And it potentially could be something that holds patients back from exploring it. And so, you know, what else do you have to say about the skepticism with regard to integrative medicine? Do you have any words of wisdom for people that are maybe unsure?
So looking inward at myself, I really, truly, honestly was not ever skeptical. I was curious, but I also thought, well, I'm focused on this right now. I'm going to continue. And then when I'm ready, I'll look into this further. And I was always exposed to coaching and then the integrative medicine fellowship program via my wife and her colleagues. But I do think you touched upon a key point here, Mike. Across the board, as traditional medicine trained physicians, we're not exposed to integrative medicine as much. Oh, now that can vary depending on your institution. Like I think at Ohio State, for example, they have a Department of Integrative Health, and so there's a program there. But it's different than what we're exposed to and trained in throughout our careers. And if it's different, we're not sure what to make of it. And we have some built-in skepticism rather than curiosity. And that might underscore our mindset as well. If we approach it with curiosity, we might realize there's a lot to learn rather than pushing away something that's just different. But I think too many of us still would benefit if we would let the skepticism pass through, put it aside, and then approach it with curiosity and just ask some questions. I mean, inherently, we all want to learn. We're information seekers, so why not run with that and learn as much as possible about integrative medicine and how it can be beneficial? So I would just say to everyone out there, put the guard down.
Like the be skeptical about being skeptical, and your advice to be curious, I think is excellent advice. And we could all learn so much by withholding judgment and just being curious. Learn so much about each other, but also learn so much about ourselves in the process. So I am sure that people are going to want to learn more about you and your program. You've already dropped your website link, which is www.connectedcoherencemd.com. And how else can people connect with you if they want to learn more about what you're doing?
He's on LinkedIn. Let me help him out here.
So I'll be honest, I'm not very active on social media, and that's on purpose, partly because I don't have the bandwidth, but then secondly, I think that's one of the things we have to kind of handle better at a social level, because frankly, that's also kind of a Truman Show. Like we're presented with things that we think are reality when in essence they aren't. They're just something that someone else wants us to believe or think. But the impact is that we're now supercharged about something rather than being present and more coherent. Anyway, she's going to tell you, I guess, how to get a hold of me.
Yes, as he said, he is really a very good example of somebody who's not on social media too much, but he does have a LinkedIn profile, which I will slowly encourage him to put his stuff out there on that. But I think, honestly, if people want to get in touch with you about this program, it's the website, www.connectedcoherencemd.com. If you don't see it, if you get that 404 error, just keep checking back. It should be out pretty soon, and there should be a link in there to get on his email list, and you'll be hearing from him that way.
So the two comments I wanted to reserve
Yes.
for the closure, one is, and this kind of comes back to what you maybe brought up a moment ago, Michael. To those out there who are listening, who found interest in this podcast and are listening, I, I would encourage you to not wait. So a positive impact for me personally going through coaching and where I'm at now compared to where I was years ago is my interpersonal skills and my relationships with folks around me are healthier now. And there's going to be folks in our lives who aren't around forever. And when you lose the opportunity to have a strong relationship with someone, you just want to be in the best position to be able to do that. And so I would say, don't hesitate, don't wait, do it for yourself and those who are important to you to get help with coaching or integrative health, integrative medicine. There's no reason. I wish I'd have done this decades earlier.
And it happened exactly when you were supposed to have it happen.
Sure.
Okay.
Second comment is hats off to you two. I know from being in this household that what you guys did with this podcast, this series, was a heavy lift, and you did it, funded by your own pockets for the benefit of others. I think it also for your benefit as well. So, job well done. And this is just the beginning. I know things are going to change and evolve, but look at what you guys accomplished. You've got the conversation shifted to these key topics, and just thank you for doing that, and nice work doing it.
That's amazing. We really appreciate that. I'll let Arpita speak for herself because she gets to sit next to you and give you a hug. But that really means so much to us. And it has been an interesting year, and it's great foreshadowing for next week's episodes. But thank you. That means so much. Really appreciate it.
Welcome.
Yeah, there you go. Every single time you bring this guy on, you make somebody cry. So maybe this is the last time he's on this.
Oh, yeah. Yeah, I guess so.
Right. Well,
Sorry.
I just have to go out to a breakfast right after this. Let me just go redo my makeup. Okay. Anyway, thank you. That was very sweet. I appreciate that. All right. Well, guys, amazing. Another amazing episode. Thank you for sharing your insight with our audience and giving them hopefully a perspective to consider. Thank you, Michael Hersh, for joining us and honoring us and helping ask some amazing questions again today.
Thank you to all of you for tuning in this week, and we will see you next time on Doctors Living Deliberately. Take care, everybody. Bye-bye.
Bye.